So, hi everyone. Today, let's talk about baby deworming. Now, whatever I'm going to speak on this video is going to be based on my personal experience out of my own research, which I have done. And it's, of course, your choice at the end what you want to do. But this is just like I'm just sharing my own personal experience. So, most of them, or most of the moms might have heard that you need to give your baby deworming tablets and deworming medications once they turn 2 years old and all that. Now, the thing is, first of all, let's get things very clear. Deworming, obviously, you need because they say that there can be not pesticides, but there can be like worms in the baby's digestive system because of whatever they eat. First thing we need to get in our mind is that it doesn't happen, worms doesn't happen in kids if they eat sweets. It happens because obviously you eat like meat or undercooked meat products or animal products. So this is one of the reason why. And also then many other junk food that has certain kinds of artificial flavoring and all these things. So these are the main causes that causes all these worms in the babies. So the second thing is, obviously not all the babies will have this issue. So there is a test. If you ask the doctor to do it, like a stool test that checks if the baby has any worms in their stools. So this test has they check for any bacteria in the stools or any worms in the stools. So if this stool test comes positive, obviously your baby has this thing, and only with the doctor's advice you need to give them this deworming medications. And I would say that if this stool test comes negative, like no worms or no bacteria in the stools, then I think it's not advisable to give your baby deworming medications. Also, the third thing what I would like to highlight is most of the mothers or most of the people, they just go to the pharmacies and they just try to get something like over the counter. Now bear in mind, not every over the counter medication is safe, and especially when you're giving it to your kids. So it's always good to consult a pediatrician and ask them to prescribe, or at least an advice from them. So obviously make sure you're giving the baby the right treatment, and not just hearing from other people and giving your baby things. So every baby is different.